And one of the things you learn when you're trying to solve complex problems about public health is that no one discipline can solve those problems. To be truly transdisciplinary, you have to recognise that people come not just with knowledge, but they come with a set of skills and ways of interpreting the world. So I'm an engineer and I'm interested in collecting quantifiable data and understanding what it tells me, looking for really rigorous, sort of rigid patterns in the data. So if you want to design a drainage system or understand a balance sheet, I'm a good person to have on the team. But a lot of what we're trying to solve, for example, relates to how people respond to risk, how people behave, how people do the thing that you don't expect them to do. So you can tell people till you're blue in the face, or you should use this toilet, it's good for your health, and people won't use it. And if you want to find out why, I would suggest that often an engineer is not the person you want. What you want is somebody that really understands about social processes and individual decision making. And so what we find when we work together is we're able to paint a picture that has all of these different sort of dimensions of knowledge. And also then you find you bounce ideas and you stretch your own discipline. So just by the very act of working together, we start thinking about problems that we're trying to solve in different ways. A really good way of thinking about this is to think about a specific project that Helen and I have been talking about for a long time and working on, which is the idea that people who live in urban slums, they live in chaotic environments and their lives are influenced by a huge number of different risks. So they face dangers associated with accidents in the home, poor indoor air pollution, immediate transference of disease between family members.
For this project, we did some preliminary work in slum areas in Kathmandu to really understand, particularly from the perspective of women, the kind of risks that they face. Any survey will tell you the key things are respiratory health and gastrointestinal disease. Those are the key problems that people are facing. But when we actually spoke to women, certainly in these communities, their biggest fears were around eviction and flooding. They were very clear about the influences on their respiratory health, which was something we were really looking at. So in terms of understanding the kinds of stoves they were using, the kind of heating they were using, they were very clear about the impacts the smoke within the home was having on their respiratory health. So there were a lot of things around improving ventilation within the homes, changing types of cook stove. But again, the kind of price of a gas cooker, it was just unaffordable for about half of the women.
It's absolutely no good giving people perfect sanitation if they go home and they're facing terrible health stress associated with poor air quality in the home.
The more of us that are working on the issue, the more ways we've got in. So for example, from the health perspective, we might work quite closely with kind of WHO and that aspect. But then obviously if we've got people in who are working from maybe the Earth and Environment Department, they might have other links in from a slightly different angle.
I think in some more traditional universities you'd be always sort of pushed to be in charge of your own research projects, if you like, but I feel here that there's a sort of a real active encouragement to be collaborative.
To be able to get the big research money, you really need to have that transdisciplinary approach. It's not really possible anymore. I think funders have realised how complex these issues are and that they can't be answered by one discipline alone, and that we do need to have that working together. So I think if we're going to be competitive in the sort of research funding, then we have to work in that way. Another reason for the importance of transdisciplinary working is that when we're working on an issue like urban policy and urban health, it's so important that we get all the different sectors working together. So a key problem in many low-income settings is that all of these sectors, education, health, transport, housing, local government, will be very different ministries and they may never come together. But our projects can actually facilitate that and make that happen.
We also have at the University of Leeds a number of structures which are specifically designed to bring people together across faculties. Probably the most relevant here would be the Centre for Global Development. It makes connections, but it's also a place where we brainstorm ideas and share problems and engage in a kind of intellectual debate. So sometimes Transdisciplinarity doesn't mean that you have to all be working on the same project. It can literally be about pooling knowledge and trying to solve problems.
The other really good thing about the Centre for Global Development is that it offers a forum for PhD students who are interested in global development to get together and share ideas and support each other, whether it's really practical things about doing their data collection overseas, or actual kind of bigger kind of conceptual issues about the topics they're working on. But it offers that opportunity for them to get together and to share experiences.
We do transdisciplinary work because we don't want to do something that doesn't make a difference.